All right, we're started. This is DIENTES, episode 3, July 9th, 2026. We're on our way back. We're going to have about a full 30-minute podcast here. We got the TikTok live going over here. And the first person to ask anything, to join was Unfunny. And Unfunny first said, I said, Unfunny, since your account's unfunny, tell me a joke. And he said, I love your face. And then he said, violation warning? Why am I getting a violation warning? No, we're not. Oh, dude, come on. The decision is, the notice is, my live does not contain the content mentioned in the notice. Submit. Okay, let's continue. And then Blondie said, Unfunny said, you're so Blondie. All right. DJ said, company car? No, not a company car. It's not a company car. It's my family car. Yeah, but I'll see if we can get write-offs. On, I don't know. All right. Unfunny said, is she your friend? Yes, this is Alexia, Dr.
Hi.
Alexia, technically, and she is my head assistant. We are a team that we do oral surgery in Westchester on Thursdays. Today was in Brewster. Next week we'll be in Tarrytown. The week after that we'll be in Mount Vernon, and then we'll be back at Brewster in 3 weeks. And we do oral surgery at our general dentist friend's offices, I guess. And so, Unfunny said, tell her she has good music taste.
Just say it, I know.
Yeah. All right, where we got here? Marco Brownio joined. Who else is on? Jay joined. Unfunny said, do you go to Starbucks? Unfunny, you mean Starbucks? Do you go to Starbucks? Starbucks? No. Tenemos... nos gustamos. Nos gustan Dunkin' Donuts,
Yeah.
okay?
Starbucks.
Cerca de Walmart. Alexis Perez said, Dana, what's up? Alexis said, how quickly are you using a handpiece when extracting a tooth? Well, great answer, because today we got new handpieces. Thank God. New handpieces and 702 burrs, and they work really good. So it was funny because we were working with handpieces a couple weeks ago, and with the wrong burrs, and in fact, the tooth was taking like 30 minutes each. It was not good. Today, full bone impacted was, the one girl, we thought they were going to take a while, and they took 7 minutes each-ish, 7.5 minutes, I don't know. It went really, really well. Full bone impacted, horizontal wisdom teeth, and so we got new burrs and new handpieces, and they worked really, really good. It really depends. It really depends on if they're erupted. The upper wisdom teeth, a couple seconds. Bottom wisdom teeth, if they're erupted, maybe 30 seconds, a minute. If they're impacted, like full bone impacted, uppers could take maybe 3 minutes. If they're mandibular full bone impacted wisdom teeth, we're looking at maybe like, if they're really tough, it could take 15-20 minutes, But today went really well. Today went really, really well. It was a really good day.
Yeah.
Our best day, actually. Our most busy. And there were still cancellations, but we had our best day so far. So day 3 of those DIENTES. Guys, by the way, top 10 listeners that stay on the longest, we're giving you a shout out in the podcast, the caption of podcast on YouTube. Okay, so, all right, let's keep going. Let's keep it going. Unfunny said Dunkin'. Yes. Dunkin' Donuts. Unfunny, do you like Dunkin' Donuts, or are you a Starbucks persona? Jay said, start D1 in a month. Any final tips? Hope to reach OMFS one day. Hope you get it too. My biggest thing would be effective and efficient studying, okay? I say this all the time, effective and efficient studying. Effective studying is getting better grades, right? CBA. And then efficient studying is maintaining those A's, but studying for them less and less, which is very important in dental school when you're taking, they say, an average of 32 credits a semester. And sometimes you have multiple exams. I remember one time we had 5 final exams on one day. Yes, and they were all important exams. So you need to get better at efficient studying. Okay, does that make sense? So let's see. So that's my recommendation. The way it worked for me was Quizlet. Quizlet premium version, putting figures, photos, X-rays, diagrams on every index card on the Quizlet version, and then just getting the repetitions in. All right. Good luck, Jay. You got this. Suri said, where'd Suri go? Suri said, you're dentist doctors. Sure. Yeah. We're both dentists. Alexia is actually Dr. Alexia. She's a trained dentist in Mexico, and I'm so grateful and fortunate to have her on our team as Dos Dientes, but as my head assistant for oral surgery on our Thursdays up in Westchester. Yeah, we were in Brewster today. So, Unfunny said, is it true dentists can know whenever you give brain asking for a friend? Actually, yes. There's like ecchymosis on the posterior palate, if that's happening, and if that's going on, and it's basically like a bruise or like a superficial bruising of the tissue in the back. But that's also not all the time. That's also not only time. That's only if. Anyway, we'll move on from there. Suri said, I need braces. Well, you won't be coming to us then. We don't do braces. We don't do Invisalign in oral surgery. You should go to an orthodontist for that. All right, let's see. Smiley Face said, is that your assistant or your wife? Alexia is my assistant. We're a team here. And we call our team Dos Dientes. So this was day 3 of Dos Dientes. I still got to post episode 2, but I will be getting that up. Wise Guy 10 said, do you do zygomatic implants? Yeah, I can do zygomatic implants. I prefer that being done with a dental anesthesiologist or CRNA or anesthesia on board. It'd be even better to do zygomatic implants with intubation, honestly, in the OR. But yeah, so we do it. We're not going to do this in a general dentist office. I would need to get this in a real, like, maybe surgery center, maybe a hospital, maybe in an oral surgery clinic, in our oral surgery clinic. But like, there's a lot to do there. Sarah Getty. I need to know where to start for jaw discomfort. Started about a month ago. So jaw discomfort could be do a number of things, right? You could be getting spasms. You could be getting, you could just be getting like a little bit of muscle discomfort from stress. Maybe you're grinding in your sleep, right? You're grinding your teeth in your sleep, clenching, stress. If it started about a month ago, it can be because of that. If you had dental work, it could also be because if like you have a restoration, like a filling that's a little bit too high in an area, perhaps. Stuff like that. Okay, there's a lot that could be involved there, but I would start at your general dentist. Get an evaluation. Maybe it's something simple. Maybe it's something you can figure out. You can always go get a consultation with an oral surgeon, but I would start at your general dentist. Okay. Suri said, I can't talk when I have stuff in my mouth. My dentist is always talking to me with stuff in my mouth. Yeah. I do like to talk to patients with a mouthful of gauze and be literally doing surgery. I try and teach during the surgery. I try to let patients know where we're at. Like, you're going to hear a crack right now. We're going to crack the tooth in half, or tenemos solo. Quick Bed Bunny break. Had to turn that up real quick. Que pasarías? One of our favorites.
Yes, mine too.
Okay, we continue. Wise Guy said, oh yeah, zygomatic implants. Suri. Prad said, do you recommend starting to study for my CBSE my D1 year? I start in August. You can, but listen, I want you to get your dental school grades down first. I want you to be getting good grades, and you can have the opportunity and make the opportunity for yourself to add on more studying, okay? Don't put it all on your plate, and then you're going to get anxiety, maybe a panic attack, like I don't know what to do right now, I'm getting bad grades. No. Listen, I want you to start with getting your grades down, all right? If you're getting all A's and you're so bored, you have so much time to spare, then that's when you add on CBSE studies, okay? Otherwise, hey, maybe take the exam at the end of D1 year, see how it goes, and then learn how because that's a different test from the other tests you take in dental school, okay? This is very important. So, Prod, one day at a time. I think that's the best advice I can give you. Gotti said, Doc, shorty bad, but she has perio. Any tips? So he's saying like a patient or themselves is bad. They're hot, I guess, but they have perio, so they have periodontitis. Look, wait, are you dating a girl with that? I don't know how to break it to. I don't know how to recommend for you to break it to the girl that you're dating. I don't know. That's tough. That's tough. Maybe tell her like, you should check out this new toothbrush that I got. You know what I mean? I don't know. I got this dentist that I go to who's great. I don't know. I don't know how to break it to. I really don't know. But for someone who has perio, like you might need scaling root plane. You should see a periodontitis. Okay. Start with a dentist. If you need to go see a consult with a periodontist, sure. Jay said, thank you. You got it, Jay. Good luck, my friend. Whatever is on my mind said, it's difficult living with teens. They eat everything. They yell. They stay out late. Yeah, that can be tough. That can be tough. JT said, I have a question regarding efficient studying. How would you do that for organic chemistry, for example? Quizlet, throw everything in organic chemistry from content and also to practice, because sometimes you need to do practice equations in organic chemistry. Some practice equations will have you start with the front molecules, right? And then the reactant, or like the reaction, I forget the name. I took organic chemistry 11 years ago. I don't remember the names, but it's like reactant and the starting and then product, right? Your starting molecules, the reactant, I think, and then products. Do the reactant and then the starting molecules and then reactant, but leave the product blank, and then draw out the equation on paper to practice, and then show on the back of your Quizlet card, the back of your next card, the answer, right? And then vice versa. Have no starting products, show the reactant and product. You have to figure out what the starting molecules are, right? Show the answer on the back, practice that way, okay? And get the repetitions in. A lot of reps, all right? That's how I would recommend doing it. I wish I had Quizlet. When I was studying in college. Maybe it existed. I was too stupid to find it. Who knows? Gio said, whoa.
Yeah.
Señor, cabrón. Dios mío. Ay, mi madre. Ay. Trying to kill us? Wow. Gio said, why can I see down into my wisdom teeth hole and it's just dark because I lost my clot but no pain? You're probably out of the window. It's probably after 7 days after that tooth was removed, after 5 days after that tooth was removed. You're probably just out of the window. It's probably starting to heal, right? The gums are starting to line that socket and you don't have a dry socket. So that's good news. 17 minutes, keep it going. LSA said, we'll start dental school soon. Good luck, LSA, you got this. TM said, are you in Philly? No. Long Island. We're on Long Island, and we do our together. This is Alexia and I. We do Dos Dientes. This is our team. We're gonna get a brand and logo and stuff. We'll make hats. You can buy it if you want once we make that. But we do Thursdays in Westchester. We go to our general dentist friends' offices, and we do oral surgery in their office for them in Westchester, New York. So not Philly. We're in Westchester, New York. Next week, I said before, next week we're in Tarrytown. The week after that, we're in. So today's July 9th. We were in Brewster today. In 3 weeks, we'll be back at Brewster. But next week, we're in Tarrytown. And then the week after that, we're in Mount Vernon. So, yeah. Yep. Sabrina said, my husband. You're...
Who? You?
Who? Robert Gunther said, any tips on past big exams? Study hard, study a lot. And I would recommend using Quizlet. Quizlet is how I really ended up figuring it out. For example, I take my paramedic national exam next month. Quizlet, man, you should be ripping those Quizlet cards right now. Good luck, Rob. Good luck. You got this. Suri said, what specialty is the most competitive and why? Should I pursue that? OMFS? Orthodontics and oral surgery are both generally the most competitive specialties to go into. That's how it's year after year. It was that way 20, 30 years ago, I was told, and it was that way 10 years ago when I was in dental school. It was that way 5 years ago when I graduated dental school, and I've talked to dental students. I know dental students now, they say the same thing. So orthodontics and oral surgery, most competitive specialties in dental school. Good luck. BL0987 said, you look delicious, bro. You know what's really funny? So I started this week at my home-based practice 4 days a week in Southampton, and the owner of the practice his wife came in and said hello to everyone in the office, and she told me that her friend came into the office 2 days ago. She was in yesterday, and her friend came in the day before that, so Tuesday. And she goes, she described you as delicious.
Wow.
She said that I was delicious. Look, I've never heard of calling someone this before. That's very funny. That's for I think she's like 83 years old. Sweetest lady, so kind, so nice. But 83-year-old woman calling 32-year-old oral surgeon delicious. I'll take it, you know?
Yeah.
I'll have to start an OnlyFans. All right, let's keep going. Julia J. Bird 1023 said, when are you in the clear from and having infections after wisdom teeth? So, I've seen infections after wisdom teeth up to about 6 weeks after having the wisdom teeth, believe it or not. I would say you're in the clear somewhere around, probably after 2 months. I'm sure there's like that rare 1 in a million case where someone, longer than that out, got an infection after wisdom teeth. But I would say generally, after 4 to 6 weeks, you're out of the clear. After 2 months, you're definitely out of the clear. Although, remember, this isn't definitive. There could be more than that. You know what I mean? All right. Where are we? Brady said, got my wisdom teeth out 2 days ago. When do you think I could eat popcorn? Brady, wait a while for popcorn. Why? Because you get the kernels stuck in your teeth. And I would wait at least 2 weeks before you're having popcorn after wisdom teeth removal. All right, give it some time. Right now, it's just soft, mushy foods. Right now, it's just ice cream, yogurt, smoothies, but no straw. You don't want to have a dry socket form. Soft, mushy foods like that, okay? Scrambled eggs, pancakes that you could squish with a plastic fork, stuff like that, all right? May La Pelas 2.0 said, that's what the
Me la pelas.
that's what the 2.0 that's the ad. I don't know what that means. You'll have to tell me later.
I don't know how to translate that. Me la pelas.
That's good.
You know, later.
Said 50% rank out of 230 students, 80 CBSE. Should I apply? I think you're in a great spot to apply, and you got a great ad. Go for it. You got this. Just don't put Me La Pelas on your resume when you apply. Oh, okay. Quick music break. Okay. You can keep going. But all right, let's continue. Tustin Smith said, getting Invisalign for TMJ, will it help? Question mark. Invisalign for TMJ, so there are some rare cases where Invisalign could help straighten out your teeth, get them in a nice line, and anatomically, yeah, it could potentially get the motion of your jaw closing better, more anatomically, and eventually it could potentially help a TMJ, all right? However, usually for TMJ, we're talking like night guard, we're talking temporary NSAIDs to be anti-inflammatories to relieve some inflammation in the area, but it's essentially like recognizing what's causing that TMJ. It could be stress, you could be clenching, grinding your teeth, stuff like that, okay? Among other things. There are other things. All right. Mustafa said, I just got my wisdom teeth removed. When am I fully healed to eat? And when can't get dry socket? Okay, when can't I get a dry socket? So essentially, you want to make sure that you're eating soft, mushy foods for a few days, okay? You can eat now, as long as the numbness has worn off, like there's no more local anesthesia. When the numbness has worn off, then you could have foods again, okay? Because otherwise, if you have it too early and you're numb, you're going to bite your lip, you're going to bite your tongue or something. Let it wear off before you eat anything. Next, you don't want to have stuff that you really need to chew for at least 3 to 5 days. Soft, mushy foods, ice cream, yogurt, mashed potatoes, soup at room temperature, smoothies but no straw, stuff like that, okay? Next, when can you not get a dry socket? Generally, you're out of the clear for a dry socket after about 7 days, okay? Yes, some rare occasion people could get dry socket after that, but generally it's after like a week, okay? What's next? As far as the dry socket goes, no using straws, no rinsing, spitting for at least 24 hours, no brushing your teeth for at least 24 hours. When you're bleeding, don't spit out the blood. Just compress with gauze with that, okay? That'll help stop the bleeding and really keep that socket in so you don't get the dry socket, all right? Mami, tú qué quieres? All right, let's keep going. Oh, I just lost the spot. Here, wait, I just lost the spot. Where'd it go? Here we go. Mela Pelez 2.0 said, LMAO, funny guy. I'll send an application. Do it. Mela Pelez 2.0 said, followed live creator. Thank you, Mela Pelez. Thank you. Dev Tro 2K said, how do you get confidence the first few months after graduation? Practice. It's really practice. And you might not be practicing getting reps in after graduation, but you get confidence based off experience. You get experience based off of repetitions, all right? Getting practice in. All right, let's go. Brady said, got my wisdom teeth out 2 days ago. When do you think I could eat popcorn? Wait, Brady. Wait on that. Dev Tro 2K said, how do you get confidence the first few months? Esnaf said, no current issues with wisdom teeth. Nice. Okay. Apo Kirkuki said, why do some people say getting a root canal is the worst thing in the world, but I enjoyed it? I don't know. Mark said, got my wisdom teeth out 3 days ago. When can I have a Zin? Well, I can't recommend Zins, but it is better than chewing tobacco or smoking cigarettes or smoking other things, I guess. Mark said, when can you have a Zin? I don't know. Wait a couple days, man. Wait a couple days. I can't recommend it all, but if you're going to, wait a little bit. DevTro2K said, how do you get the confidence for some okay. Let's get some new ones. Where are we going? Here we go. Christian Medina said, hey, put the volume up. Yeah. Mira said, got my wisdom teeth out last Thursday. Nice. And my jaw's still stiff as hell. Okay, yeah, that might take another week or so. What you can do for now, massage the masseter muscles. That's over in this area, right? Massage those muscles and work on jaw exercises. Opening, and you could push and hold for 30 seconds or so, like this. And push and try to hold your jaw open, okay? That'll help stretch the muscle, and then massage out the muscle. I would say give it another week. It'll get better. You give it practice, give it time, it'll get better, all right? Next, what do we got here? Zayada 3 Mur said, do you watch football? I haven't been able to watch the FIFA as much as I'd like to, but Alexia has.
Yeah.
Alexia is from Mexico. Yeah. Alexia likes Mexico. How many games have you watched with FIFA?
Well, I watch all the Mexico games and all Colombia games, but not anymore. Now I'm with Norway.
Yes, Norway.
Yeah.
Holland. Alexia said that her significant other, her boyfriend, cried when Colombia lost. Oh,
yes.
Man. And you cried when Mexico lost?
Yes.
I saw the video with the girl in the shower and she was pouring the wine bottle with the shower running on her face. Yeah, sometimes we feel that way. Yeah.
It's okay.
Let's see, what do we got here? Ryland said, when can I wear my retainers? Wait about a week. I would say wait about a week after wisdom tooth removal to wear your retainers, okay? Khalil083 said, can I shoot you a DM? Let's connect. I'm a financial advisor. I do have a family financial advisor, but sure, you could send me a DM if you'd like. A DM would be better on LinkedIn, I guess. Adam&Eve said, did you guys take out student loans for dental school? I did get help with dental school, but I had to pay for all my weekly expenses. I had to pay for rent. I had to pay for gas. I had to pay for my growth. Like all the weekly expenses, everything, rent, the living situation, I had to pay for. Bilbo Ball Baggins, that's so funny. He was on last time we were on. Is your name Pfizer? Because you made my heart stop. Oh, jeez. You said that last time. That guy or girl said that last time, too. Luigi De Luca said, nurses, dentists, and oral surgery. Mother T said, why don't dentists want to touch cancer patients on chemo? Chemo kills your teeth. It's a difficult situation. Generally we get a lot of patients on chemo. Chemo does kill your teeth. It's generally good to get all bad teeth out before you start chemo, right? There's usually a dentist involved when patients are starting chemo or another like IV bisphosphonates, among other things. But yeah, It's because you could get MRONJ, medication-related osteonecrosis of the jaw, and that can lead to infection and bad things and jaw fractures, like a whole process of complications that can be very, very detrimental to your health. So, yeah, go to an oral surgeon if you're curious about that. All right. Dr. Chopped said it took me 3 weeks to eat solid foods. It's a long time after wisdom teeth to eat solid foods, but I guess there are cases out there. Bilbo Ballbaggin said, "Is your name?" Oh, yep, we said the same thing. Where are we? Mark said, "Thanks, G. You got it, Mark." Here we go. Prad said, $540,000 for total loans at Case Western. I really hope it pays off. Keep pushing, Prad. Keep pushing. That is a lot. I know. That's a lot. That's putting you in a big hole. So take your time. I hope you're planning on saving money throughout college. Throughout dental school. I hope you're planning on doing, after residency, you don't just start spending like crazy like I see some dentists doing. Save money. Okay? Don't just start spending like you're a hip-hop artist. T said, "No, it's not." What's not, T? What about it, T? Monica said, "I have my daughter's appointment with you in September." No way!
Oh.
No way! Monica, where's that appointment? Where's that appointment? Because we're no longer at Oral County. We're in Westchester, and I'm in Southampton on Monday, Tuesday, Wednesday, and Friday. But Dos Dientes, Alexia and I, we're the Dos Dientes. Dos Dientes stands for 2 teeth. We're in Westchester on Thursdays. So, Monica, if that's where you're going, hope to see you. Either place, hope to see you. Demon. Sophia said, "Only got one of my top wisdom teeth out Monday, and it's fully grown in. When can I work out?" On Monday, you're getting pretty close to it. Generally, I say wait a week, but if it was fully erupted, you're probably almost just about good. You know what I mean? Side to side and top emoji said, "Patients really be like, got my wisdom teeth out yesterday. Can I smoke and use straws and eat chips?" Yeah. They do that every day. Yeah, that's true. That's a fact. They do that all the time. It's crazy, right? Adam&Eve said, "My sister took out $100,000 in loans for dental school, and the interest is crazy. It's like, when I was looking at loans, it was like 6 or 7%. Insane. It's insane. It's getting to the point where it's like, it's getting to a point. You know what I mean? It's scary." Kate said, "Can you do Xanax and nitrous for root canal and crown for severe anxiety?" So you need to consult your dentist with that. Hopefully you're going to an oral surgeon. Oh, for root canal? Yeah, you're going to an endodontist. Talk to your endodontist about that, all right? Because listen, you technically can't sign consent after taking Xanax, all right? So that all needs to be done. All the paperwork and consent needs to be completed before you take your Xanax, all right? And the Xanax take like roughly it takes roughly like an hour or so, 45 minutes to an hour to set in usually, right? Because it's a benzodiazepine. So then you have to wait in the waiting room a little bit. So just giving you a heads up, all right, Kate? Good luck. Just listen to me said, "I just had a root canal and my dentist prob effed it up." What? Why do you say that? Sophie said, "I feel great already." Good, Sophia, that's great. That's good. You're probably just about ready. We're not in Babylon. No, that place looked like that Babylon office we went to.
Oh, yeah.
Big thing.
What is that? I don't know.
It's a professional thing, but we're not in Babylon, so thank God. Thank God we're not. What was it? Wednesdays? Oh, we used to work at the same office, and they started putting us in Babylon. We did one day there, and they were nice, and it was good. There was better insurances, but we were getting passed around. Yes, we drive more now, but we're having fun.
Yeah.
We're having fun, and we do better.
Yeah.
We do better. It's our thing. It's a better opportunity where we see less patients, we get more time with them, we make more money. It's a long commute, but it's one day a week. It's all around better. I'm so thankful for this. I really am.
Too.
And so that's why we do our episode Dos Dientes. Again, episode 3, guys, on the TikTok Live, the top 10 listeners that stay on the longest. We're giving you a shout out in the caption on podcast and YouTube. Okay, let's continue. 20 Catherine 21 said, "When I was awake, why was I awake during my wisdom teeth surgery?" Yeah, sometimes, I mean, not all wisdom teeth you need to go to sleep for. Sure, if you're getting all 4 teeth removed and they're all impacted, yeah, might be a good idea to go to sleep for it, but there's a couple things involved there. Tijuana said, "How about TMJ disorder post-extraction, the ear pressure not equalizing due to that?" that should level out. That should get better over time. If you're still having that after a couple months, you should see an ENT. That's interesting. Val said, love the music choice. Yeah, Val. Yeah, Val. There we go. Khalil803 said, did you check TikTok? Do you check TikTok DMs? Oh man, I gotta make more time and check more of the DMs. I do check my immediate DMs of people, but the DM requests,